A nurse educator is often seen as someone who simply teaches in a classroom. But in reality, they carry the responsibility of shaping future nurses and ensuring patient safety through proper guidance.
Good morning, everyone. First day as clinical instructor, and I think this will be much easier than hospital duty.
Miss Faith, before anything else, do you know your responsibility as nurse educator?
To teach students,
Not just to teach, but you must plan and prepare lessons, teach and demonstrate the skills, supervise students in clinical duties, and evaluate their performance. Most importantly, you must ensure patient safety. Every action your student makes reflects your teaching.
okay, let's see. 8 a.m. lecture, 10 a.m. skills demonstration, 1 p.m. clinical duty supervision, 5 p.m. student evaluation.
A nurse educator's day is carefully structured, balancing academic and clinical responsibilities.
Okay, manageable. Good morning, class.
Good morning, Miss.
So today we will not just learn about theories. We will prepare for real-life situations.
Excuse me, Miss. What skills should we focus on as student nurses?
So you need communication skills, critical thinking, clinical competence, patience and empathy, leadership and accountability.
Miss, is proper assessment part of critical thinking?
Yes, assessment is the foundation of all nursing practice. And remember, skills are not just memorized, they are practiced and applied. Miss Balboa, kindly come in front for the demo. Everyone, please observe carefully because every step must be done carefully to ensure patient safety. Now, who wants to try? Anyone?
I'll try, Miss. Place the cuff 1 to 2 inches above the elbow crease, aligned with the brachial artery.
Okay, can you get the blood pressure reading?
Yes, Miss. 120/80, Miss.
Very good. Proper placement and positioning. Now, who else wants to try?
Miss, I'll try.
Stop. That is why it is very important to pay attention to small details because it could greatly affect the patient. Make sure that the patient is relaxed, seated comfortably, feet on the ground, and arms on heart level. And place the cuff 1 to 2 inches above the elbow crease. There you go, you got it. Before we start, remember, always assess your patient first, think before you act, and ask when unsure.
Yes, ma'am.
Ma'am, what if I make a mistake?
That's why I'm here, to guide you, but you must also take responsibility.
Yeah, just put it down. Put it down. I think they won't mind. Yeah, that's okay. Just put it like that. You remember that when you did that?
Excuse me, are you the CI?
Yes, sir.
Ma'am, please monitor your students closely. Their actions affect patient care.
Okay, sir, I understand.
Mom, am I doing this right?
Wait, stop. Let's reassess first. What is your patient's condition?
I think stable po.
Don't assume. Always assess first.
Mom, I don't feel well.
Look at that.
Who is the clinical instructor?
I am Doc.
Your student made an error. You should be supervising closely. Nurse!
Let's reflect first. What went wrong?
Mom, sorry, we didn't assess properly po.
That's why critical thinking is important. Always analyze first before acting.
Yes, we understand now, ma'am.
Stop. That is why it is very important to pay attention to small
Look at that.
Ma'am, please monitor your students closely. Their actions affect patient care.
Who is the clinical instructor? Your student made an error. You should be supervising closely. Nurse!
Every action your student makes reflects your teaching.
In every mistake, there is a consequence. And for a nurse educator, those consequences are not theirs alone, but also their students and their patients.
I thought it was just teaching. I thought it would be easier than bedside care. But it's not. Everything I teach, they bring with them to the patient. Every mistake can cause harm. Every wrong decision can put a life at risk. This is not the easier path. It's actually more challenging. Because I'm not just handling students. I'm helping shape future nurses who will handle lives.
In that moment, she realized being a nurse educator is not just about teaching knowledge, but ensuring that knowledge is safe, accurate, and life-saving.
Every nurse begins as a student. We learn that even the smallest details can affect patient care.
We learn from our mistakes and grow through correction.
We learn to think before we act.
We apply knowledge with responsibility.
We gain confidence through proper supervision.
We shape our future nurses through guidance and discipline.
Because every action in healthcare has consequences.
And every patient depends on safe and competent care.
And it all starts with a nurse educator who chooses to guide, not just teach. We are future nurses, guided by dedicated nurse educators.